Well, welcome everyone. Thank you for joining Lifestyle Prevention today. We've got a number of speakers that are going to be talking to you about a number of offers available and services. That should take us up till about 20 past 3, and then we can have about a 10-minute break, and then there is the social prescribing session, which will be on the same link, so you're more than welcome to stay. Okay, so should we start with Cassie?
Yeah, brilliant, thank you. Shona, did you want to share the slides?
Yeah, no problem, I'll get that up on my side now.
Brill, perfect, thank you. In the meantime, while Shona's doing that, oh brilliant, here we go. But afternoon everyone, hope everyone is very well. So I'm Cassie Moore, I'm a Public Health Assistant Strategist at Camden and Islington Public Health. And I am here today with Rosie Morgan and Shona Dugan, telling you about NDPP. Can you flick to the next slide, please, Shona? Perfect, thank you. Okay, so for those of you who don't know, the National Diabetes Prevention Programme is a joint initiative between NHS England, Public Health England and Diabetes UK. So the programme is delivered nationwide by 5 providers, and Xyla Health and Wellbeing are our provider that delivers NDPP in North Central London, so the 5 NCL boroughs. Essentially, NDPP aims to deliver behavioural interventions for people with non-diabetic hypoglycemia. I think Rosie and Shona are going to talk a bit more about that later on, so I'll kind of stop there with that. But essentially, public health are responsible for the strategic development and generating referrals onto the programme by supporting primary care to identify and refer patients onto the NDPP programme. So last year was fairly difficult in terms of referrals, due to in part obvious kind of additional pressures on primary care. But we obtained funding for a few pilot projects to increase referrals, and the kind of aim was to increase referrals whilst not adding pressure onto primary care, and also looking at reducing health inequalities in terms of access to the programme as well. So we ran a centralised referrals pilot, which did really well, and we saw a 70% increase in referrals during that project compared with the 2 months prior at the start. So that was really great. And we're also developing a community engagement project, which is targeting kind of high risk communities in NCL. And also a diabetes community testing project, so that will be delivered across NCL with community partners, focusing in areas of high deprivation. And finally, from me, there's just a link at the bottom of that slide there. So it's just an e-learning course that's available on NDPP, if you wanted to click on that and find out a bit more. And now I will hand over to Shona or Rosie, one of you.
Yep, it'll be myself. Thank you, Cassie.
Thanks.
So I'm just going to touch a little bit over the overview of NDPP and some Camden specific data a little bit later on. So first, nationally, the eligibility criteria is that patients need to be aged 18 or over, not pregnant and registered with a GP in North Central London. So the HbA1c blood test result and gestational diabetes are 2 components where NHS England have adjusted the criteria to allow more patients to join the programme in light of the pandemic. So the HbA1c blood test result has expanded from 12 months to 24 months, and patients with a history of GDM are now eligible to join the programme. It is really important to note here that the HbA1c blood test result, although has been over the past 24 months for quite some time now, this will return back to the 12-month timeframe from the 1st of April 2022. So the scope from NDPP aims to identify those with non-diabetic hypoglycemia and now individuals with a past diagnosis of GDM, to offer them a lifestyle intervention encompassing group educational sessions to reduce their weight. And we've approached this through the promotion of eating well, moving more, and taking charge of their behavioural change. So due to the pandemic, the service is still being offered remotely, and groups have been running successfully since the end of March 2020. And patients have a choice between Microsoft Teams, group sessions, which provides a more interactive online group session, or fused telephone groups, which is for patients who maybe don't have access to a smart device or the internet. And having these two platforms has been really great for patient flexibility, and it's given us the ability to meet the technical needs of patients whilst everything has been remote at this time. So the referral will be picked up by our patient support team, or PST we call them, and they will then contact patients to book them in for their initial assessment. So their initial assessment is performed by our central health coaching team, who will ask demographic questions, provide background on the programme, and then finally attempt to book them onto the programme for the group sessions. So our sessions are where the majority of the learning occurs. So the first 6 sessions are fortnightly, and then they move to monthly occurrence, as we allow service users to time to exercise their learnings from each group session to ensure that these healthy actions are regularly implemented to form a lifelong habit. So once they've completed the programme, and everyone will finish with a one-to-one end of programme review to check in and signpost them to other services as well. So here we have our service model, and this is what we call the service user journey, starting with the darker purple boxes up here at the top as the referral options, and then this follows all the way through the programme up until the discharge point. It's really important to note here that the gold standard referral is what comes from primary care and other healthcare professionals, and these gold standard referrals contribute to the site profile and the overall target that is set by NHS England. So we have the Diabetes UK Know Your Risk tool as well, which is the direct to consumer pathway, which was developed by NHS England in light of the pandemic, which bypasses the need for a blood test and instead requires an online risk score. And this allows self-registering onto the programme if they have a score of above 16. But these referrals don't contribute towards the NHS England site profile because the blood test isn't required at this time. And then just at the bottom in blue, I just want to highlight our digital arm of the service, which is through Oviva. And this is for maybe where group sessions won't be appropriate for the patient. And this pathway includes online learning modules, so digital literacy is required. So then moving on to the patient journey, here's a snippet of the patient journey once they have been referred, assuming this has come from the gold standard route, which is with a valid HbA1c. So this branches off into 2 segments, those with an email or mobile number and those with a landline only. So those who give us an email or mobile number at the point of referral, we will get in touch with them and they'll be directed to the relevant webpage with a specific URL, which will guide them to self-book onto the programme, where the patient can simply self-sign up. If they haven't signed up via text or email within the first 5 days, we will give them a call, and this is alongside all of the other patients who have only who've been referred to NDPP, but they've only provided us with a landline, and we'll offer the groups that way. So if a patient doesn't pick up after the first 3 attempts of contacting them, we'll send them a letter to inform them of our attempts and ask them to call us back within the next 30 days. Failure to call us back, they will discharge them back to the care of their GP. And equally, those who decline appointment and group sessions more than 3 times, we will also discharge them back to their GP. But until that point, we will send them details of upcoming groups twice a month that they can book themselves onto. So just touching on equity of access, we run our group sessions with patients in the top 7 most referred languages onto NDPP. We have bilingual health coaches that run these sessions with translated materials also available. And alongside our language groups, we also have piloted a number of other groups, such as gender specific, age specific, to target those hard to reach populations. And we are currently piloting an easy read pilot group for patients with learning difficulties. And we are working with NHS England to hopefully pilot a gestational diabetes specific group as well. So just at this point, it's important to note that any additional needs that your patient has, that this is added to the referral form so we can offer them the most appropriate service. So we just want to highlight the importance and the efficacy of the programme and the key outcomes that we have achieved in North Central London for this second framework. So as we know from emerging evidence, controlling risk factors such as hypoglycemia and obesity could really help diminish the impact that COVID-19 is having. We have 97% of our patients feeling that they are able to continue with these lifestyle choices, changes made throughout the programme, and this is really key to long-term success for patients and for primary care. And we want to be able to reduce pressure on primary care by having less unnecessary hospital admissions, fewer GP appointments, and just overall support for GP and healthcare professionals when referring their patients onto NDPP. So just looking at some of the data, this is the monthly actual referrals over the last 6 months, which has been split down by borough in North Central London. So Camden has been highlighted in the bold red line, and on average is referring less than 50 patients a month. With a few months left of this framework, we would like to do everything that we can to drive these referrals further to reach the target set by NHS England. And just for some reference here, the monthly target for Camden at the moment from now until the end of the framework in July is 130 referrals per month. Looking at that on a larger scale here from the start of the framework in August 2019, these are the cumulative referrals for Camden, and the green line is the target which has been set by NHS England over the last 3 years. So cumulatively, Camden have reached 34% of the target, and in January, the monthly target that was reached was 24%. And here we have some of our resources that we can share with referrers to support those quality conversations with patients and information on how to refer through clinical systems. Just to give some insight, I'm quickly going to run through our consultation checklist, which is a step-by-step guide as to how an opportunistic referral can be made. So the first is to check is their blood within the HbA1c range of 42 to 47 millimoles. Second is to explain the blood test results, so explaining that some factors are controllable and some are not, including age and ethnicity. So the take home at this point is to explain the level of risk appropriate to that patient. Next is then to explain what type 2 diabetes is. So it's really important to highlight at this point that because they are not yet diabetic, that they aren't actually diabetic. This is pre-diabetes. So if left untreated, high sugar levels in the blood can lead to complications of diabetes. So encouraging your patients at this point to take action to prevent or delay diabetes by making these lifestyle changes is imperative. And patients will have support of this throughout their NDPP journey with our health coaches. Next is to have a discussion about the options, including barriers, benefits, and motivation before making a referral. So this is really key to making a high quality referral to ensure that the patient gets the most out of the programme and achieves all the way through. And then lastly, offering a referral. So if a patient agrees, a referral form can be filled out online on their behalf or through the clinical systems. And at this point, it's really important to encourage uptake and emphasise that the programme is free and it's backed by the NHS. We do have flexible starting times, so we do currently run groups on the evening and the weekend remotely as well. And it is available in different languages, as I previously mentioned. So we can share all of these resources with you after this session if you'd find it useful. So what we'll do is we'll pop up all of our emails in the chat box should anyone wish to get in touch with us directly. And lastly, I'm just going to touch on a few frequently asked questions that we've had from some previous meetings. So first is, how do we find out if a patient self-refers onto the programme? So as long as the patient fills in their GP information on the referral form, if they're self-signing up, the GP practice will be notified via email when that patient has taken up the programme, which is attending their first session, or has dropped out. Which would then discharge them back to the care of their GP. We'll send this with a read code. If this isn't given at the point of referral, our patient support team will gather this information when booking onto group sessions, and the GP will be notified again when they've joined that first group session. The second question, do we get paid if patients self-refer onto NDPP? So as part of the enhanced weight management incentive, so patients who do self-refer, it will lead to a payment as a result of this incentive. It's £11.50 per referral, as long as they have their NHS number, their HbA1c blood test result, and the date that it was taken, assuming it is within that currently 24-month period, but after April 1st will be 12-month period. But this is only applicable for patients who are on the obesity register. And then lastly, how does NDPP feed back to GP surgeries? So we currently email the GP with a read code if the patient has either attended their first group session, is discharged back to their GP for not joining, when they complete a programme, or when they drop out during the programme. And that's it. Does anybody have any questions? What I'll do is I'll put all of our emails in the chat box, and if anybody wants to pick up anything with us offline, do get in touch. Thank you.
Excellent. Thank you so much. Does anyone have any questions? Please feel free to shout out.
I got one. I'm really sorry. I'm sure you've said it already, but I just wanted to clarify with the gestational diabetes group. So are you saying that anyone with a history of gestational diabetes can be referred with a normal HbA1c?
Yes, that's correct.
Okay, that's good to know. I didn't know that. So that's quite a lot more than patients, I guess, that would, yeah, that's good to know.
Yeah, it's quite it's a new criteria, so we're still finding out how to reach those population groups, but it is something that we are hoping to pilot to do a group specifically just for those in that category.
And they don't need to have any other sort of issues like being overweight or anything like that. It just okay.
Yeah, as long as they're even if they're normoglycemic now, if they've had prior history of GDM before, then they are eligible.
Okay, lovely, thanks.
Excellent, thank you. I don't think we've got any more questions in the chat. We will share the slides after as well, so everyone will have those. Thank you. So next we have Julie.
Hi everybody. I'm Julie Edgecombe. I work in the public health team, Camden, Islington. I'm just going to give you a whistle-stop tour on child weight management services across the borough. Thanks, Esther, for putting the slides up. So my contact details are there if you need to get in touch with me after. I just have to give you a bit of a warning. I'm experiencing network problems today, so if I lose my signal, you'll have the slides and call me if you want me to, to find out more. So moving on, Esther, please, thanks. I don't think it will be any surprise to you that we've got a considerable issue across the UK around obesity in children. Recent statistics show that we've got 19.8% of children in reception that are overweight or obese, and that is 1 in 5, and that increases up to 1 in 3 for year 6 at 35.9%. It might be worth mentioning that the National Child Measurement Programme, for those of you that don't know, is a national scheme that's been in operation for a number of years. So we measure children in reception in year 6, and some boroughs provide follow-up to those children to offer them support. So just looking at the next slide, we can see that over time, it's pretty stable, it fluctuates, but we do a 3-year rolling average to try and understand what's happening here. And in Camden, at the last time that these slides were kind of updated due to the pandemic, I'm going to move on to a little bit of a summary in the next slide, that we were seeing some signs of reduction in children in reception. Having said that, last year, because of the schools being closed, we weren't actually able to get into schools to measure children. So we did have a much smaller sample. And I'm not going to present to you the local findings because they're quite skewed because of the way that we targeted. So we did measure 15% of children last year and 30% of the children in the previous year. But not surprisingly, the 19, 20, 21 national results are showing that actually obesity in children has really significantly increased, and we are seeing that the biggest increases in reception, and that the signs are showing that there's further widening of inequalities that's going on here. So we will have some slides that we'll be able to share with you if you're interested in what that looks like across the piece in terms of children by ethnicity, gender and deprivation, but they're not available to share right now. So I'm just highlighting what the national headlines are for you here. Can you move on to the next slide, please? So in Camden, we take a whole systems approach to obesity, and there's lots of work going on across the council, but we do concentrate on kind of looking at a whole system environment and thinking about what an obesogenic environment looks like and how we can tackle that. So we're doing a lot of work in our team and across the council and with our colleagues in voluntary sector and the NHS on improving the food environment, looking at what the food offer might look like in schools, early years settings, hospitals, public spaces, and thinking about where we can kind of create change around sugar reduction and education, and then increasing obviously access into physical activity services. And a lot of the work takes place, as I've just mentioned, in settings, and it's a lot of work to try and explain within one slide. I'm going to move on to talk about the services that we've got in place to actually follow up on children who are identified as overweight or very overweight, just give you a little bit of a flavour of what those services actually do. So if you move on to the next slide, please. Okay, so there are, on the GP website, you'll find that there are 3 pathways that are will signpost you through the different services. We've got 3 pathways, one for early years, one for primary age children, and one for 12 to 18-year-olds. And dependent on the actual weight categorisation of the BMI of the child would depend on the service that they're actually offered. So we've got universal and targeted offers. So we start with the universal offer, which is the Families for Life programme. So within Camden Council, there's a whole range of programmes that are actually available to families that are universal, so anybody can sign up to them. So there's a lot of online cooking and eating classes, and they were once upon a time done in person, but due to COVID, we've actually maybe managed to modify this so that it can be done online, and they're really successful. So 4 to 6 week programs with cooking and eating. We've got weaning and starting solids courses, and we've got a range of other activities that children can take part in, and those, I'm going to send you the links to those. I'm going to send a leaflet to you that gives you all of the contact details, but the leaflets are actually loaded onto the GP website as well, along with the pathway. So all of this should be quite intuitive if you're familiar with using that programme. So the Healthy Living Service is the follow-up. So that's the one-to-one service for children who've been identified as overweight or very overweight. This service is actually attached to the school nursing team. So it would be the equivalent of the adult weight management services like Slimmer's World. So we're trying to support families on a one-to-one basis to address kind of healthy lifestyles, set personal goals, look at increasing access to physical activity, and doing some education around a healthy plate and what that looks like. And that will depend on the level of resource within the team. So what we actually do is we follow up on the NCMP letters, and we offer that service on a one-to-one basis for anybody that's identified as being very overweight. And then if the case is very complex, we've got an enhanced healthy living service, which is delivered by the Brandon Centre. So if there's a complex case, they would be referred into an MDT, and within the MDT they'll discuss that family and the child with early help and think about the most appropriate services to refer them into. So that's chaired by the UCLH Obesity Clinic, and the options there are for professionals to be given one-to-one consultation and support on managing that case. They could refer the parent onto a parenting group called Families, Food and Feelings, which is a 6-week course that parents take where they can collectively talk about supporting each other around weight, which is managed by psychologists. And those are the main services that we've got, but also within the pathway you'll see that we can refer into other physical activity programs as appropriate, which will be based, all of that information will be on the council website. If you could just move to the last slide now, I'll just show you what this booklet looks like. So we've created a colourful booklet for parents to try and destigmatise kind of what healthy weight might look like. So we try to avoid using the word obesity, and we're trying to support them to gain a healthy weight. So this leaflet is updated every year and sent out alongside the NCMP letters, and it's available on the GP website. So that would be quite a useful one if you actually wanted to if you're speaking to any parents or young people and want to know what services are available. That's it for me. Thank you.
Thank you, Julie. Does anyone have questions for Julie? Free to shout out or put something in the chat. No? So thank you, Julie. That was great. Thank you. Okay, so then we've got Esther.
Hi everyone, I'm Esther. I work in the public health team across Camden and Islington. Unfortunately, got me for triple whammy. I'm going to talk briefly about our Making Every Contact Count training. I'll then run through our mental health training offer and talk a little bit about the services and support available around suicide prevention. So we'll start off with Making Every Contact Count. We could move to the next slide, please. Just a brief recap on what MEC is, or Making Every Contact Count is. I'm sure many of you will be familiar with this. It's really about making the most of all of the opportunities that we have with residents and patients across all of our support services. It's focusing on prevention, recognising need and supporting people to access advice and support early on. It's an approach that's endorsed by NHS England. I think it's also important to recognise what MEC is not about, and it's not about adding to the already busy workload that we know staff are experiencing, or about them becoming experts in all areas, but really around equipping them with the skills and empowering them to have short, opportunistic conversations. Our training is free, so it's very simple and low cost to introduce across the workforce. And I think just to recognise that we know that many are already doing great work in this area and doing MEC in one way or another, and our training is really to support people to do it better. We can move to the next slide, please. So a little bit about our local approach to MEC. So you might have completed MEC training in another trust or local authority. In Camden, we have a really strong focus on the wider determinants of health, so thinking about employment, debt, housing, as well as conversations around key behavioural risk factors. Our training's delivered virtually, used to be face-to-face, it's now delivered over Zoom, and really about equipping the workforce with the skills and the confidence to support good quality conversations on what can often be sensitive subjects. The training's accredited by the Royal Society of Public Health, and it's free to anyone who lives, works or volunteers in the borough. It's a good opportunity, so I can talk through the offer. The training may be relevant, useful to yourselves, but also to think about other colleagues or members of the team that you work with who may also benefit from the training. Move to the next slide, please. So we're currently offering 2 different training courses under MEC. So our kind of mainstay of MEC is called Good Conversation, Supporting COVID Recovery. It's a 2-hour training session delivered over Zoom. It covers what is MEC, so really about identifying those opportunities for person-centred conversations. It goes into some of the key issues that people are experiencing, especially at this point. Thinking about some of the impacts on the rising cost of living, issues around employment, housing. It goes through what a good conversation looks like, how to make every contact count. So we use an ask, assist, act model, and then talk through the resources that are available to support those discussions, so including self-help resources as well as signposting to local services. We have open courses that people can just book onto directly. I've included the web link in the slides that I'm sure will be sent round afterwards. And we can also, if we've got between 10 and 15 people from any organisation or group of organisations, we can also arrange with the provider to set up some bespoke sessions. So that means that slightly adapted or tailored to the needs of the groups. So please do get in touch with me if you think that there'd be an opportunity within your organisation. Move to the next slide, please. And the second course that we offer is the basics of motivational interviewing. So it's just a slightly longer session. It's a 3-hour session that's delivered over Zoom and really kind of intended for staff who are having slightly longer interactions. So, you know, the opportunity to have 10-15 minute conversations with residents. So it covers the key principles around motivational interviewing. It's very interactive, so there's a lot of examples that participants will use to kind of critique, and then a focus on how to put those motivational interviewing skills into practice. Again, we offer that as an open course that people can book onto, or it is also possible, if there's sufficient numbers, to look at doing a tailored session for an organisational group of organisations. Move to the next slide. Thank you. Just to highlight, I think, you know, we do get really consistently good feedback around the quality of the training, how people have valued the opportunity to kind of network and meet other people working in the local area, but perhaps from very different services to their own, and how even if they had some experience or knowledge around the kind of, you know, what good conversational techniques, I think still being able to extract lots of value and from the kind of refresher approach. You can move on to the next slide. I just wanted to highlight a couple of services finally, if I haven't convinced you to sign up to our MEC training. Also recognising at the moment that lots of families and individuals are struggling with the increased cost of living. We have some great services in Camden. I just wanted to highlight the Wish Plus service and the support that they can provide around housing and particularly around energy efficiency and help with energy bills, as well as our Good Work Camden employment support service. The information about all of those, or both of those services, the websites are included in the slides. So that's it from me on our MEC training. Happy to take any questions on that now or at the end of the other slides. I'll pause for a moment, see if there are any questions specifically on our MEC training. No, okay. Johanna, if we could move to the mental health training slides, that'd be great. Okay, thanks. So just a little bit of context. I'm sure these are statistics that you'll all be familiar with. We already have high levels of mental health need within Camden. So estimated 20% of the population aged 16 plus experiencing common mental health conditions. That's from data predating the pandemic. We know that the pandemic has had a significant impact on people's mental health and well-being. Some recent modelling from the Centre for Mental Health applied to the Camden population predicts that among adults there'll be 30,000 new cases of moderate to severe anxiety and 41,000 new cases of depression. So you can see that there are rises of 16 and 22% respectively, and among under 25s predicted 14,000 new cases of depression, so a rise of 20% from before the pandemic. Levels of depression and anxiety remain highest among women, young adults and people from Black, Asian, minority ethnic backgrounds. So we offer various training courses around mental health. So we have mental health awareness training, we have mental health awareness for managers, we have mental health first aid and managing suicidal conversations training. So all of the courses are free to anyone who lives, works or studies within Camden. And again, some of these courses may not be as relevant to yourself if you've already got quite a lot of experience in any of the areas, but it's a really good opportunity to think of wider teams and colleagues that you work. So just to briefly run through our mental health awareness training. So this is a 3.5-hour session that's delivered over Zoom. It's delivered by Rethink Mental Illness. It goes into what is mental health, what is mental illness, stigma and discrimination, communication, and tips and ideas around how we can look after ourselves. All of the training courses can be booked directly on the website. We include a link in the slides, which again, I'm sure will be circulated after the session. Can move on to the next slide, please. We also offer a mental health in the workplace for managers training course. So this is also 3.5 hours delivered over Zoom. So as well as the kind of core areas covered by the mental health awareness training, there's an additional focus on management tools and really thinking about supportive conversations in the workplace. Again, you can book on directly on the web link. Thank you. We can move to the next slide. We also provide mental health first aid training. So the training's delivered by Rethink Mental Illness. It's a slightly longer time commitment for the mental health first aid. So it's 10 hours in total for 2.5 hour sessions. And there is some pre and post session work in addition to the 10 hours of the live sessions. We offer a youth or adult version of the mental health first aid, and it really is a more in-depth training than the mental health awareness or mental health for managers course. Move to the next slide. And finally, just wanted to highlight the Managing Suicidal Conversations training that we offer. This is delivered by the Samaritans, really supporting staff to understand and be able to recognise some of the factors that can lead to suicide, and to be able to recognise and respond to some of the signs of distress and suicidal thoughts. And importantly, how to have those conversations and where to signpost people to for support. So it's 3 2-hour sessions for that training, so 6 hours in total. And again, there's a link to where you can book onto the courses if it's of interest. Just to highlight, if you are pushed for time, there's some brilliant training from the Zero Suicide Alliance. There's 2 options available, a 5-minute version or a 20-minute version. So would really recommend that if time is more of an issue. And then finally, just to run through some of the suicide prevention support services that we have locally. So across North Central London, we have a support after suicide service. It's a really flexible offer of practical and emotional support for anyone who's been impacted by suicide. So it could be in the immediate aftermath or from a longer time ago. It can be for bereaved relatives, friends, bystanders, or first responders. The service accepts self or professional referrals. There's also the Listening Place, which is face-to-face trained peer support for those who feel life is no longer worth living. It's based in Camden, and again, accepts self or professional or other referrals. We have James's Place, which is face-to-face therapeutic support for men in suicidal crisis. That only accepts professional referral. And we've included the links to the referral form and the referral email address. And then finally, Maytree, which is a short stay residential service for people in suicidal crisis. They accept self-referrals. And then just finally, to wrap up, just to highlight some of the national and online resources that are available around suicide prevention. So the Stay Alive app, Calm helpline, Shout helpline, excellent resources on the Good Thinking website. So there are resources across London around lots of tips and ideas around looking after your mental health and well-being. Samaritans, telephone numbers. And finally, also just to say, if anyone's particularly interested in joining work that we're doing around suicide prevention, then please do get in touch. We've got a suicide prevention partnership group, lots of work happening at the moment to pull together an action plan around what our prevention work will look like across the system. It's my colleague, Jane Brett-Jones, who's leading on that. So if anyone is interested in taking part in that, then please do get in touch with Jane. That's it from me. Again, a bit of a whistle through our mental health training and suicide prevention support. Happy to answer any questions, or if people have any thoughts or want to get in touch after, then please do. My email address is in there.
Thank you, Esther. That was brilliant. We will share the slides. I know there was a lot of links in there for everybody. Does anyone have any questions for Esther? Pop your hand up or put it in the chat or shout out. No, I don't think any questions. Thank you so much, Esther. Thank you. Okay, so just moving on, we have Kausa.
Yes.
Hello, welcome. Thank you for joining.
Okay.
Put your slides up.
Okay, just move on, please. So my name is Kausar Sanat, and I do manage the GP and pharmacy side of the Stop Smoking service. I'll just give you a bit overview of some contextual information on how the service actually delivered, and then we'll just touch base on this making every contact count, because we heavily rely on referral from other partner organization, and also some of the challenges that we are facing, plus the referral pathway and contact information. Next slide, please. So Stop Smoking service in Camden has been managed by Solutions for Health, and this is an independent provider and commissioned by Public Health, and they have been doing this in Camden since 2012. But in 2017, it combined with Islington service with a new branding called Breathe, and the delivery of 3 levels of service to support the lifestyle and individual preferences of the smoker. Next, please. So this is the branding of the Stop Smoking service. It's called Breathe. And yeah, this is the new branding. So if you see any poster, you know that that's the Stop Smoking service across Camden and Islington. So the model of the service we provide is 3-tier. The first one is the self-support, and the next one is a brief support, and tier 3 is a very specialist support. And then I'll just tell you more about it. Next slide. Yeah, the self-support is for those people who want to stop smoking or contemplating to give up smoking, but they don't want the formal face-to-face professional help, but they just want some information and some kind of printed materials, or just posting some website. And also they just want to speak to some stop smoking advisor via telephone. So we do provide that very basic support, and through our website they can just contact us, giving their information. You can call back them to give any support they want. Next, please. So brief support is the majority of our support kind of intervention. There are smokers who wants to engage with the service, but at the same time they don't want a very heavy commitment on regular kind of every week. So it's a more brief support, like a first assessment session, and the follow-up session is over the phone, and the final session is like taking carbon monoxide reading. And so, as I said, there should be at least minimum 2 face-to-face sessions, and along with the telephone and video chat as well. And the frequency and intensity of this intervention obviously depend on individual smokers' kind of preference. If someone prefers to have that kind of support every week, we can do offer that as well. Yes. So there are some smokers who have got very multiple and complex need, or heavy smoker who had so many quit attempt. For those kind of smokers, we do provide very flexible and adaptable service who needs a bit more longer to stop smoking. And this can include the pregnant women, or smokers with a mental health or long-term condition as well. So in terms of eligibility criteria for this specialist support, they should have they should be willing to have a intense intervention, and also to put a time and effort as well required for this kind of intervention. And it is delivered by our Breathe specialist advisor. These are like a very specialist trained advisor who are the core Breathe team member. So they're kind of can focus longer term intervention. So traditionally, the Stop Smoking service, as a part of National Health Service, is mainly 4 to 6 weeks kind of support system, where they set a quit date, and the progress is monitored over 6 weeks. And after that, if they can't quit, and they should be discharged from the service. But with this tier 3 model, and especially in the Camden and Islington, they can have extended support even they fail at 4 to 6 weeks, and it can extend to 12 to 14 weeks. So yeah, this is very specific in Camden and Islington, not in other boroughs. This service is available. Yeah, next please. So in terms of smoking prevalence, it has gone down substantially in last 10 to 20 years. At the moment, it's roughly 14% across nationally, and London, 14% as well. But compared to the national average, Islington and Camden has got pretty high prevalence of smoking. In Islington, it's 23% and 20% in Camden. So obviously lots of smokers, and lots of survey shows that more than half of them, they just want to quit. And obviously they need support as well for that. Next one. So some of the groups in the demographic kind of things, there is a very high rate of smoking, and that include people in manual occupation, people with mental health problem, prisoners, and some difficult family relationship, people in the unemployment, poor education, single parent, living with the parents who smoke, and substance misuse. In this kind of group, the kind of prevalence is much higher than the general population. Yeah, next please. So in terms of the priority group, there are some priority group where giving up smoking will give quite a substantial benefit, and that's why there is some targeted approach for this kind of population group, like routine and manual worker, where the prevalence is very high, young people who start smoking, how to prevent them from the beginning, and Black, Asian, and minority ethnic group as well, people with a mental health problem, and pregnant women. For some of this group, like except the young groups, there is a quite a good incentive to the pharmacy and GPs to target this population, and with a kind of extra payment for that as well. Next, please. Next one. Yeah. So in terms of our service delivery provision, we obviously used to run a community clinic across Camden and Islington in wide ranging of setting, including the mobile van. Obviously that has changed over the pandemic, but I'll touch base more on later on. And the GPs and pharmacy, also our key provider of a service, they provide mainly brief support, and they have got a contract with the public health to provide that service. And myself as a GP and pharmacy lead, I do provide all the advisors who are based in the practices and pharmacies across Camden and Islington. And we do have a very close contact with Acute Trust and Foundation Trust, plus volunteer community organization. In some places we do offer on site as well, like in Royal Free, where our advisor goes there and just to provide direct service to the patient as well. And campaigning and promotion of service is one of the key areas as well. We do provide training as well. We do organize brief intervention training, level 2 advisor training, annual update training for all the existing advisors. Next, please. So this is one key national campaign. A national No Smoking Day and Stop Tobacco is a part of the national campaign, but New Year is more like a localized campaign to kind of motivate smokers to give up smoking. Next, please. In terms of the treatment that we offer, we do follow the protocol of NHS Stop Smoking Service with a twofold strategy. First one is obviously arranging the medication to deal with the physical withdrawal symptoms of the giving up smoking. And that includes nicotine replacement therapies, Champix and Zyban. And the Champix is out of market since last June. The Pfizer, who is to produce this, for some reason stopped it. It was very popular before, so we're having a little bit of challenge situation there. And we also provide very much behavioral support to break the habits, which include behavioral counseling, practical advice and support, and reassurance and encouragement. Next, please. These are the kind of all different kind of nicotine replacement products, which actually mainly is given according to the lifestyle of the smoker, whatever suits them. Yeah, apart from nicotine patches, all of them are oral product, and combination and therapy is much kind of effective, like patches and any other oral product as well. Next, please. My colleague here, obviously you mentioned about the every contact count, and we do really appreciate that because you come across in different setting a lot of smokers, and it's really important that you understand that what service we provide, so that you have a clear idea about it, so that you can raise the awareness of our Stop Smoking service and the treatment that we offer and how to access the service. And also referral to Breathe Stop Smoking service is one of the key area that we really rely on our partner organization. And also opportunistically, you can raise that profile of the service as well as the motivation of the smokers around this national campaign, where there's a campaign goes on nationally for No Smoking Day. I think next one is on 9th of March. And the Stoptober is during this October period, where the encouragement is given to the smoker just to stop for 1 month, like 4 weeks during October. Yeah, next please. So the very brief advice, that's the core things that we really rely on, again, on our partner organization. So instead of I think Esther mentioned about this 3-step. Obviously, the one middle step is more advising clients that a little bit of engagement about smoking and health, and then the final one is actually referring patients to our service. So this NCSCT e-learning is a very, very useful organization. The NCSCT National Center for Smoking Cessation Training, it provides, it's an online training hub, and anyone can access it. And it is especially the free online short training on the very brief advice is very, very powerful short training as well. So yeah, it will be really worth watching it. It's a very short training, but very effective one. Next one, please. So in terms of the explaining our Stop Smoking services, mainly it's a free service, and we do provide very flexible service. It can include even evening and weekend as well. So in terms of the service itself, the first session is more assessment and planning and preparing for giving up smoking, plus arranging for NRT, and the follow-up session is more 10 to 15 minute practical advice and motivation provision for the supply of the NRT or any other medication. Next, please. So in terms of our performance, it is quite challenging for us to get even to meet the basic target because of the lot of challenges that we face in our service. I will touch base more on later on. But obviously, COVID put in effect, but there was a pandemic effect as well, reduction in the smokers accessing the service. In Camden last year, we got 711 4-week quitter, and Islington it was 703 4-week quitter. Next, please. So in terms of our service adaptation during COVID is that all our face-to-face service was transferred to the telephone service from mid-March 2020. And because we do the carbon monoxide, that blowing machine as well, obviously that is also stopped completely. In terms of the demand for service, we thought that pandemic will have a bit more positive effect in terms of helping people to give up smoking. But in certain settings, especially the frontline setting, pharmacy setting, it drastically went down. Obviously, the people wanted to reduce the contact of anyone as much as possible. But on the other hand, the GPs actually, even though they are overstressed with their work, they did more referral to our service. So that was a bit positive aspect. And there was also introduction of the e-burn for clients who really struggle to give up smoking, especially people in the supported accommodation. And finally, there was a specialist post was appointed in 2020 June to specifically target this pregnant smoker, and that was really getting very, very fruitful result so far as well. Next one. So the challenge is a low footfall. There is not only Camden and Islington national decline in smokers accessing the stop smoking service in all settings. In last 10 years, there's a nearly 80% drop in the people accessing the service. Obviously, e-cigarette is one of the key factors there, but it's more like hardcore smokers now who are much difficult to motivate and access the service. And even though there was a downward trend in smoking prevalence across all population, but in some of the groups, it didn't change. It's still very high. Again, it's a mental health problem plus COPD, for whom actually it's much harder to achieve the quit rate. So one of the key learning things that we have had during pandemic is that the telephone service actually helped us to reach more people, especially people with a caring role, mobility issues, or shift worker. And in that case, actually, our DNA rate, because people used to travel before to come to the clinic, but when this telephone service started, and it was like a much more kind of engagement with the patients. So that was a very, very learning things for us. So in going forward, it's very likely that this remote delivery model will remain, and maybe in future we have more hybrid model of face-to-face in certain setting as well as the telephone service. Next, please. So in terms of our service, we have got a website, the Breathe Stop Smoking website. We have got more information there. And for generic inquiry, there's a dedicated telephone line and our NHS 2 email address as well. Next, please. So this is our website kind of page. Yeah, if you go there, you can have lots of detailed information about all different elements of our service. So the referral pathway, this is anyone, our eligibility criteria is anyone living, working, studying in Camden or Islington, they can self-refer via our website. There is, and self-referral can also be made by calling this number plus quit text message. And professional referring to the clients, and they can use our referral form as well. And finally, all the GPs in Camden and Islington can refer patients directly through their emails if they download our referral form in their emails, and then they don't have to manually input any data. If the patient's file is open, and then with the click of a button, all the referral forms will be populated, and that can be sent to our Breathe NHS mail. Next, please. Yeah, this is it for me for the moment. If you have got any query or anything, you can always contact me. My working days Monday, Tuesday, and Thursday. Yeah, any question, I'm quite happy to answer. Thank you.
Thank you very much. Does anyone have any questions? No, I don't think any questions. We will share the slides as well, so everyone's got the information and links and stuff. Thank you so much, Kausar.
Thanks.
Thank you. Okay, so next we've got Lucinda.
Hi there, can you see me okay? Hi, so my name's Lucinda. I'm one of the recovery workers within CGL. So CGL is Change, Grow, Live, and we provide the drug and alcohol service within the borough of Camden. So to be referred, it can either be through self-referral, it may be a parent who refers also as well, but they need consent from the patient and the client that's being referred within the service, or the referral may come through the GP. The best way to actually make the referral is to either call CGL in Camden, and the numbers and the referral emails I can pass on. And the main CGL email, if you want to make note of that now, actually is camden.referrals@cgl.org.uk. And you send a referral to that email, and then what will happen is you'll be contacted by one of the recovery workers, and the patient or the client will then be invited to have an assessment. Once they've had an assessment, then they'll be placed with a key worker. The key worker will then work with the client or the patient for a minimum of 6 weeks. This will usually be one-to-one supervisions. It may be by telephone or it may be face-to-face, depending on the preference and the needs of the client. During COVID and recent times, they've all been telephone consultations, but now the COVID restrictions are lifting and things are becoming more how they were pre-COVID. Face-to-face appointments are much more readily available. So we provide this support for people with drug and alcohol problems. Within the borough of Camden, we actually have 3 services. So there's the alcohol service, which is ICAS, and that's separate to the drug service, and also the Routes Off the Street service. So the Routes Off the Street service, that helps with people who have homelessness problems. So they can be referred once they're within either the drug or alcohol service to Routes Off the Streets, help them find a key worker to maybe move them into a hostel if they are actually sleeping on the streets, and then link them in with provisions to help them get into maybe volunteering and into job opportunities and things like that, help them rehabilitate into everyday life. The alcohol service, that's provided on Arlington Road, and that's a service that's referred in through the same way, actually through the same Camden referrals email, but it's a separate centre at the moment. And they provide alcohol support, so people who are having difficulties with alcohol misuse. The main services that are provided there, again, is key working. So it will probably be a minimum of 6 weeks key working. And also they provide rehabilitation. So if the client would like to go into a rehabilitation, it's usually off-site. They can make the referral through being engaged with ICAS. So that could be residential, or it could be a community detox. The community detox, you work with the key worker and you work on building a plan to help reduce your alcohol use within the community. Whereas residential, like I was saying, that is actually a residential stay for a minimum of 6 weeks off-site at a rehabilitation centre. The community detox is usually the preferred route, and it's very successful. People who have more complex mental health needs within the borough may actually be referred initially to CGL and then have an onward referral to the Marguerite Centre. So the Marguerite Centre is placed on Hampstead Road, and they have much more better provisions in terms of complex mental health. So they have the care then transferred over to Dr. Dunn, who's one of the consultant psychiatrists at the Marguerite Centre, to help deal with their substance misuse problems. So there's different pathways in terms of outreach as well. So there's the GP surgeries. So myself and some of my colleagues actually are placed in the GP surgeries. So the patients, clients that are more stable within their recovery aren't necessarily seen at the drug service anymore, but are seen within the GP surgeries. And this is very good because it links in with helping them with their physical health. Because a lot of the people who've been misusing substance misuse for many years, they can have problems with their lungs and COPD and many other problems which are resulted from long-term drug use. And so this is much more better managed within the GP surgery, and they can have easier links with the doctor and have their medical reviews and things like that. So it's a much easier route in terms of managing their physical health and their substance misuse. Another service which is provided within the borough for anyone, and this is professionals and anyone seeking help for substance misuse themselves, is a web chat. So this is a free and confidential service which is provided via the CGL website, not the CGL Camden website, but the main CGL website. And you can just go onto there and click to speak to somebody. And it's a service where you can ask for advice, whether it was about a family or a friend, whether it was a self-referral, whether it was just to get some more information around drug misuse or alcohol misuse. And it was professional inquiring. Professionals may want to inquire about the referral pathway that way as well. So it's a really, really useful service. So it's open throughout the day, and it's also open in the evenings as well. So when the phone lines close at 5 p.m, the web chat is available between 5 and 9 p.m. in the evenings. So that's a really, really handy resource. It's also a very good resource in terms of getting people into the service for things like collecting naloxone. So naloxone is an opioid antagonist, so it's used to reverse the effects of opioid overdose. So if somebody, it's quite often people who are injecting overdose, a family member or friend who is with them at the time can use the naloxone on the patient, and they need to use it at a right angle in the top thigh, and it revives them very quickly. So we provide the naloxone from the drug service, but we also have naloxone within the GP surgeries, and people can find out more about that through the web chat as well. And we have had people request naloxone and to know to come into the drug service to collect that through the web chat. Every client and patient within the borough is offered naloxone. If they decline naloxone, they have to give reason, but we encourage everybody to have it at home. Every patient and client is provided with a safe storage box. So this is to safely store their medication within the home, out of reach of children, out of reach of anybody else who should not have access to that medication. And it's also a very good way of making sure that everyone who's engaged with the service has access to everything that they could possibly need in terms of managing their recovery through their alcohol and drug use, and helping them find those next stages afterwards. We also linked in with it's called the Street Homeless Project, but it's not actually necessarily for people who are street homeless. It's called SHP, and they provide an aftercare service. So once people have gone through the recovery and have hopefully achieved what they wanted to achieve, whether that's abstinence or just reducing on their substance misuse or alcohol use, they can link in with SHP and then be provided with an aftercare service which will link them in with volunteering opportunities, help them with the personal management, so mental health well-being, getting them involved in activities such as recreational activities and sports and things like that, and help them really establish themselves back into the community after going through what can be a very difficult journey going through substance misuse problems. So yeah, that's the main overview of the substances, the services that are provided in Camden in terms of alcohol and drug misuse. I'm not sure if anybody has any questions, but I can put all the links to the referral email and the web chat and everything into an email and send that to everybody.
Yes, please, Lucinda, if you could send that to me, I'll forward that on to everybody.
Okay, thank you.
Does anyone have any questions? No, I don't think there's anything in the chat either. No questions. Thank you, Lucinda.
Thank you very much.
Thank you so much. That was great. Thank you. Okay, so next we've got Nancy and Anthony.
Hi there.
Hi, Nancy. Welcome. Thank you.
Hi there. Do you have the slides there?
I do have two. Let me just bring them up.
Johanna, I sent mine just as this meeting was starting. So
yeah, I've got your two.
Brilliant.
Another one.
I sent mine last week. Should I send it again to you now?
Please, Nancy.
Tony, do you want to go ahead whilst I send this over?
Sure. I could start off with the young person's sexual health service. So basically, Camden and Islington jointly procured a young person's sexual health service, and that particular service has been running for a couple of years and has just been recommissioned with some changes that I'll talk about. But basically, the sexual health service for young people is a network that consists of three main providers across the boroughs that deliver clinics, counselling, outreach work, and C-card condom scheme and other services. So what we're sort of talking about is contraception, emergency contraception, testing, and some sexual education and relationship education. The C-card service specifically being a service where young people can access condoms and lubrication, and also some expertise in how to use it. The network gives sex and relationship education to young people in schools and community settings. So that's in colleges, youth hubs, etc., across both boroughs. There are three main clinics in the network. So that's Brook Euston, the Brandon Centre and Pulse Islington, which is staffed by clinicians at the Homerton, but they will have clinicians there who are able to basically run the clinical elements of the service, like basically the coil and hormonal contraceptions, like the implant, etc. There are also outreach clinics in both boroughs that do targeted work with vulnerable youth groups, and they also offer training for professionals to help basically deliver the service as well. The sexual health clinics are for anyone aged up until the age of 25. And with the new service that's coming online in a couple of months, the actual eligibility age will be lowered. I think it's people, Nancy, you can correct me if it's 18 upwards as opposed to now, I think it's 21.
Yeah, no, it's actually staying the same. We were going to change it, but we've kept it so it's it's up until 25, and it's kind of 16 and upwards.
16 and upwards, so yeah, up until 25, and then they would move over to adult services. So basically the service is there to help and guide and give non-judgmental service and education and sexual health information, as well as contraception and testing. Basically they've made a huge effort to make sure that they are sort of youth focused when they're giving their support. And the contact details I have on another slide, so if you can move to the next slide, please. So basically the core services, or the things that you'll get, as I discussed, are the C-card and condom service. I know that the C-card service is currently available in pharmacies as well as other community settings, but with the new service, we're hoping to improve on that service by taking it online and with a bespoke app. We also provide emergency pill and contraception, should young people need that. And also pregnancy tests and advice, checkups and treatment for sexually transmitted infections, sex and relationship information and support and education, as well as a wealth of other signposting and other services around counselling, mental health and wellbeing support, so more of a holistic approach to sexual health for young people. Move to the next slide. Yep. So with regards to the three providers of the service, you might have heard of them, but the Brandon Centre obviously leads on the sex and relationship related training for staff working with young people in both boroughs, and they coordinate the condom and C-card scheme. Brooke also delivers targeted outreach to vulnerable young people and is being subcontracted to co-deliver the condom card scheme. And Homerton University Trust also are service providers in both boroughs, and they operate out of the Pulse clinics. So there are a number of Pulse clinics that young people can access if they need advice, support or contraception. They will contact the clinical outreach in a variety of locations, and Pulse sees young people up to the age of 25, as do all the other services. The Homerton also coordinates services within that network. If we can move on to the next slide, this is just a sort of map of the borough. I think that's Camden and Islington, and you can see that there are actually quite a few sites that young people can access to basically, normally the service times are from different places, but usually during business hours, but there is some evening provision, so it takes into consideration young people who may be in college or at school or what have you. So that's just a map of where people can access these services. I can tell you that all of the services as well are on the CNLW GP website. So GPs who want and need to refer into any of those or all of those services can find that on that website. And I know that because I was contacted earlier this week and last week, that information is current and correct and continually updated. So GPs shouldn't really have any trouble finding ways to access the service, the referral pathway. And I think it's the final slide. So yeah, in conclusion, basically in 2021, that was last year, the Young People Sexual Health Service was recommissioned by us in Camden and Islington, and the new service is to launch in the next couple of months. So there'll be continual service provision, but there'll be a launch in the next few months when the new service goes live. It'll carry on with the work of the current sexual health service to young people. But when we reviewed the current service, we did that in co-production with young people. So we sort of wanted to ensure that young people's views from the current service could be taken on board when procuring the next service, so their voice is all the way through the sort of governance, policy and procedure of setting up this new service. And our focus will be on making clinics spaces more young people friendly and less hospital-like and clinical. There'll be another focus on relationships and sex education, which is more inclusive, which has more of a discussion about pleasure and issues around LGBTQ+, which definitely needs to be developed and was certainly identified by the young people. Training and support for GPs to better understand the needs of young people and their sexual health. There'll be increased contraceptive options. Not always, I think, what young people find, especially if they go to GPs, is sort of suggested the pill, but sort of a wider suite of options around what they can do to manage contraception. And there'll be increased options for barrier-type contraception, so not just condoms for men as well. A lot of these services traditionally are done face-to-face and in clinics, but we'll be widening access to the service with a development of our online services and apps, which will hopefully help lower barriers and stigma sometimes attached to these things and give a greater access to younger people who are especially more tech-savvy. So last slide. To continue basically, like with the C-card scheme, which is currently offered in different sites across the boroughs and at pharmacies, we'll be sort of taking that into, I guess, the 21st century with a more advanced app that young people can access so that they can gain access to condoms and lubrication, and an online offer as well. We'll be providing a service to young people with a range of disabilities, that's physical and learning disabilities, as it was identified that there was a need in that area for people with cognitive, physical and sensory impairments to be able to gain access to information, signed services, and also with the new building that we've procured to make sure that it had full accessibility for wheelchairs, etc. So that's going to be a continual ongoing piece of work. Also, again, as I said before, we'll be more inclusive to LGBTQ+ needs. So one thing that was identified was that people through the current service might have experienced being misgendered, and will have a greater use on the correct use of pronouns, etc. Also, more of a focus on sexual orientation. Information and data on all of the protected groups will be routinely discussed as part of the contract management. This information will be used to support ongoing needs and assessment and service development as identified by the younger people. We want to make sure that their voice and their identities, plural, are heard. We hope to strengthen the commitment to providing service provision for gender reassigned service users, which was found to be an area of development that we needed to take on board. So that include being more inclusive of the language that is used and being more aware of the appearances, not determining the gender and not making assumptions. There'll also be pregnancy and maternity focus, actively identifying when a young person may need additional support, seek to refer them to the most appropriate service in a sort of dynamic conversation with clinicians, GPs, or people involved, rather than just signposting. So that's the new and improved young people's sexual health service. I think, Johanna, that might be the last slide. Yeah. And also, at the same time that the young person's sexual health service was retendered and reprocured, an HIV support service was also procured, and that is about to go live in the next couple of months. It's a HIV support service for anyone who is affected or newly diagnosed by HIV, but also their friends, significant others, and carers. In this slide, you can get a visual diagram of the service model and referral pathway. And what we were seeking to do, as there are many HIV support services currently that have, under now a joint banner, will be delivering the services as a sort of consortium. We wanted one single point of referral, so there wasn't a continual repeating of application processes. So as you can see, a service user's journey, there'll be one point of assessment. They'll have a face-to-face assessment and or a phone assessment, keeping those processes to a minimum where information is gathered. Then they will be given, in a sense, a sort of almost like a plan, and they will be referred on to some of the many other services that will be provided. But also throughout this journey and this process, we want sort of GPs to be very much included in that planning, and to increase relationships so that we can look to all of the services offered by the service providers and start to have things like social prescriptions that GPs can utilise. As there is training as well as service provision, so that service users who come into this HIV support service can also become part of its network co-production, so they can benefit from training and becoming practitioners themselves in some of the interventions that they have. So if we can move on to the next slide. So just so you have an idea of some of the services that and some of the service users that are actually delivering the service. Counselling and talking therapies is something that will definitely continue to happen for people who are newly diagnosed, to help them not only better manage their diagnosis, but also to help people who are currently, for instance, long-term medicated, and help them to better self-manage. Positive Health is another facet and another agency that's involved that looks holistically about lifestyle, health, diet, exercise, etc. There'll be outdoor activities, well-being workshops, life coaching, art therapy, benefits and welfare support, advice and advocation, and work and skills training, community events, newly diagnosed courses for people who need them, and that would also be available for friends and family as well, and education forums. So the suite of services being provided is for people who can be in any number of situations, including hard to reach communities, sex workers, really complex cases where substance misuse, housing issues might be involved. And if we can move to the next slide. So the core offer of the HIV support service comprises of the provision of a support service covering physical and mental health and well-being, information and advice, training and knowledge, and signposting. All services will be accessible for a wide range of service users and includes a combination of online and face-to-face service provision from accessible locations within the boroughs of Camden and Islington. Because the service providers who came on board are located all across London, that does mean that we're able to offer a wider service with more access for people to engage with the social care side as well as the clinical side, and also outside of office hours, increasing the offer to people who might work a 9-to-5 job. Service users form the basis of the invitation to tender and process, and so they're an integral part, the service users were, in forming the shape process of this whole procurement and what the service model looks like and will look like moving forward. Part of the service includes the network co-production group, so people who come through the service can join this group so that they can basically be the voice that helps develop all aspects of the service, policies, procedures, recruitment and governance. So their voice will shape the future structure of the service in moving forward. Next slide. So the service works jointly with Camden and Islington Council, local voluntary community sector services and health partners to provide and support service users. So service providers will offer the one-to-one assessment and sort of counselling stuff, and group level support for service users as well, where it's been identified in their needs assessment. Safe and welcoming environment free from stigma, provide timely access to the service for options for signposting when necessary, and that's to keep the whole referral process short and targeted. Embedded service user feedback and co-production is introduced into the service at every part. We'll effectively manage partnership working with community-based services and clinical services with a goal to seek to develop dynamic working practices to deliver social prescribing in conjunction with GPs. So that's sort of part of our big plan moving forward. And you can see a list of the actual current providers of the service. Some of these organisations I'm sure you'll be very familiar with, but obviously working under the one umbrella providing the support services that we've got a great deal of expertise. So we've got Positive UK, the Bloomsbury Network, Central YMCA, Terence Higgins Trust and Food Chain. They'll be the service providers for this service. Is that the last slide or is there one more, Joanna?
That was your last.
That was the last one. So if anyone's got any questions on any of those services, please feel free to ask. I'm sure we'll be able to answer any questions you've got. And like I said, all of that information will go onto the NCL website, GP's website, the GP section. So we'll be keeping that information up to date and also use some of the options for training materials, etc., or any other sort of data that we need in order to find out how to do it. So any questions? I'll take that as a no.
Thank you so much, Anthony. Thank you. Okay, Nancy?
If I take myself off mute. Thank you. Okay, so these are the generic kind of sexual health services that are in Camden. So the generic services are open access services, and they're an integrated offer. So that's STI, contraception, all those things. Bearing in mind they are open access, anyone from Camden can access a clinic anywhere. But these are the ones that are kind of like specific to Camden. The way that Public Health commissions the sexual health services is that since Public Health became responsible for them, and the last kind of act that changed the commissioning responsibilities, we've commissioned the contract with 4 of our partners in NCL. So that's Barnet, Haringey, Camden, Islington. So through those 4 boroughs, we've got our lead contract is with CNWL, and CNWL has a large clinic in Mortimer Market, the Mortimer Market Centre in Capers Street. It's got a large one on Holloway Road, which is the Archway Clinic, and then there's some more there that you can see across Barnet. Camden and Islington residents tend to stick to Camden and Islington, although we do see them going into central London quite often. So there's an open access system. They can access anywhere, and there's a tariff-based payment system, which means that the money follows the patient wherever they go. The commissioner will get billed for that. There are 2 community clinics in Camden, but they have been shut since COVID, unfortunately, because we weren't able to sustain them with social distancing and clinical staff and staff shortages. And so the last CQC inspection for our provider CNWL was rated outstanding. They are a specialist centre. They're a centre of excellence and training. They get involved in research, etc. And so they really are good providers. Next slide, please. Okay, so these are the services that are provided within the integrated service. As Tony said, the information for you in terms of referral systems and all that sort of stuff is on the GP website, so you can access it easily there. So they provide routine STI testing. As of October 2020, routine PrEP was rolled out. I'm not sure how much you know about that, but that's obviously that's now open access, and all our kind of sexual health clinics are able to access. They're all forms of contraception. They have targeted clinics which are targeted towards SMM, sex workers, those that have learning difficulties, and they also provided some targeted outreach services. So these outreach services are services that are they go out to kind of homeless hostels. They go out and see the women that are working out on the streets and in saunas, and they go to kind of cruising sites where men might be having sex with men. Over the last year, we have developed an ITSVA post within the Islington Clinic, and we've now developed that, so that's a wider offer across NCL, so there will be a specific ITSVA within the Camden clinics as well, so that's quite exciting. That's something that's going live in the next couple of months. Those posts are being recruited to. There's some co-located commissioning services within the CNWL clinic. There's quite a few different commissioners involved in the sexual health pathway, unfortunately, but we do try and tie it up together when we can. So there's also an opportunic cervical screening offer within the clinic. So cervical screening is the responsibility of NHS England, but if people go in there, particularly kind of high-risk women, etc., and there's an opportunity to kind of give them a cervical screening whilst they're there, they will do that. CNWL are also involved in one of the main providers for HIV treatment and care across our sector, and they also provide the HEP service and find and treat. They work with the find and treat team within that help service, so targeting people that are lost to follow up and kind of all those individuals. Next slide, please. Okay, so other services outside of the CNWL clinics, as I've said, any clinic in London is accessible. Over the last couple of years, we have commissioned an online service which is called Sexual Health London. That was commissioned to be an integral part of the sexual health system, and particularly for asymptomatics and low risk individuals. It was to kind of support capacity within clinics. So kind of like the higher risk and kind of the needier were seen in the clinic. Over the course of COVID, that contract's been varied slightly, so it does now see people that have got some symptoms, but again, it's very much a low risk service, and will signpost people back to clinic that really need to be seen face to face. We've also got Public Health also commissions some locally commissioned services across with GPs. So there's a sexual health testing service, and there are contraception services, which are implants and LARC. They have been going quite some time now, and we are looking at kind of trying to transform that service into fit with the new PCN model. So that work is ongoing at the moment. So we've kind of got a bit of the old service, and come April of this year, we'll be moving into the new model. Along with that, we also commission, pharmacies to provide EHC. Again, that's quite a historical service, and that will need to be looked at in the new world with other options going on, what could be prescribed over the counter with the pharmacists. Then we have abortion services are commissioned by the CCG, but as part of our role is a kind of co-commissioning. The team that I work in, my role, has also had oversight of the abortion services. So there's 3 providers in NCL that a woman can be referred into, and they do the majority of the activity. There is some abortion services available within the NHS, but the majority of it is provided through the community providers. Then there's the Havens, which is a SARC forensic unit for those that have experienced some kind of abuse, etc. And there was also more recently a service called the Lighthouse opened in Camden specifically, which was aimed for young people. The reason I've got question marks on that slide is I believe that it's been kind of stepped down a bit over the last few months, and I don't really know that much about how that's going to continue forward, but I think it's quite a small service now, so I need to find out more information about that for you. So just generally, those services as is, I mean, like all the other services, COVID-19 has had a huge effect on these services, particularly kind of open access face-to-face. So as I've sort of said, some of the community clinics haven't been opened for some time now, and we as commissioners and providers need to work together to look at what we really do need to provide within our boroughs and what we can provide across London. and take some of the learning that's happened through COVID with the there's a lot more remote access than there was previously, so we need to really look at what that model looks like. Again, like other services, there's been lots of staff redeployment, sickness and shielding, which has also had an impact on access for people wanting to go to our services. I've told you about the contract variation and the community clinics. I don't want to sort of say coming out of COVID, because it always seems to change again as soon as we feel like we're getting to the other side. But clinics are open again and are now in a better position than they were a few months ago. The main issue we have in our sectional health services in Camden and NCR and across London is that we have got a huge demand for our services, and they are still not running at full capacity. There's also an awful lot of pent-up demand in the system, particularly with women wanting access to LARC. So again, that is something else that we've been looking at. We have put in place some additional COVID-related contracts to try and increase capacity to LARC. So, for instance, one of the abortion providers is providing some additional activity so women can access LARC from them. And some of the GPs in Camden have put on extra activity. So again, that's all something that we need to look at, kind of coming out of COVID and looking at how we're going to take that forward. But any questions, you can please email me, our team, and as Tony's referred to, a lot of this information is available on the GP website. That's it for me, unless there's any questions.
Thank you, Nancy. Does anyone have any questions? No, I don't think there's any questions. Thank you both so much. Thank you for your time. Thank you.